is Ashna Malpani, and you're listening to the University of Chicago's Public Policy Podcast.
Welcome to Latin American Matters, a podcast about the innovative policies and political debates Latin America has to offer to the rest of the world. Stay tuned to hear from policymakers and experts talk about their research and practice all over the continent, from the Antarctic to the Chihuahuan Desert.
Hi everyone, and welcome to those who are joining us to listen to our second Latin American Matters podcast. It is a conversation about the healthcare system and the pandemic in Colombia. This is Paola Riveros, a second-year MPP student at Harris School of Public Policy at the University of Chicago. Today, Paul Díaz will give us his insight into Colombia's response to the coronavirus crisis. Paul is Deputy Director of Health Regulation in the Ministry of Finance. He has a Master's of Public Policy from Berkeley and a bachelor degree in Economics from Los Andes University. Colombia has 211,038 confirmed cases of coronavirus after 4 months of lockdown since March 25. Policies in response to the pandemic have been rigid to face the challenge of the healthcare system, and recently have become more flexible to recover part of the economy. Thank you, Paul, for being with us.
Hello, everyone, and thanks for having me here.
To start the conversation, in Colombia, how the supply of tests, ventilators, beds, and personal protective equipment to attend the pandemic have increased in the lockdown period.
We started the pandemic with around 7,000 intensive care units. I would say that the main difference between a hospital bed and a healthcare unit is given by the fact that intensive care units have ventilators, monitors, all that part, the infusion, the pumps, all that part that is really important when people get into this really, really bad situation where they develop pneumonia and are not able to breathe properly. So we started with around 7,000 ICU units, and we went into the market and we're aiming to buy 6,000 more. So the really problematic part, which is something that the whole world is facing right now, is when the pandemic started, everyone had like a installed capacity of their healthcare systems, which was not thought for a pandemic, meaning you didn't need that surplus of ventilators, right? So everyone started freaking out. The whole world started buying ventilators, and the problem was that the supply could not meet that surge in the demand, right? So it's a slow process. We are hoping to have those 6,000 additional units from here to, I'm guessing, September. We've just received around 300 more, like public ones, plus all the ones that the private sector has bought. And we've just started distributing them in municipalities where there wasn't none. So for example, in the Amazon, we only had one, and we installed around 15 more. The problem is we went there with the ventilators. This is a problem that I just learned about. We couldn't even, they didn't have the oxygen something to connect the ventilators. So we bought the ventilators, but the hospital couldn't take them. So we're just fixing that part, and we've just started distributing in places where we had little. And as far as the protective equipment, we're trying to buy around 25 million masks. We're trying to buy the gloves. We're trying to buy all that. We've just allocated around 400 Colombian billion pesos. We're getting there. It's a slow process because the whole world is also buying that. I remember that at the beginning, even some countries prevented their own companies from exporting more. A lot of companies that were not in the personal protective equipment business started making a lot, like, for example, gowns and face masks, all that. A lot of them just shifted their production to that. I feel like we are better prepared now to handle the pandemic than what we were when we started. And that's pretty good because we feel like the peak is coming between July and August.
Related to the quarantine, how this policy has reduced the spread of the contagious in Colombia.
So, did you measure how fast a pandemic is spreading is given by something that's called the reproductive number, right? So I believe that the reproductive, and what does the reproductive number mean? It means how many people are going to become infected for every person that's infected, right? So for example, the reproductive number means that if I get infected, how many additional people am I going to infect? And for coronavirus, it was estimated somewhere between 2 and 4, with a point estimate of around, if I'm not wrong, something like 2.7. And what you wanted to do was to bring that number below 1, right? If you have it below 1, then you're in a really, really good situation. There's a really famous Colombian epidemiologist. She became really famous now during the pandemic. And last week, she published how that reproductive number has changed in Colombia. You can see, before you had the lockdown, it was really high. Then we had this strict lockdown, nobody could go out. We had below 1, and now it's estimated to be a little bit below 2, if I'm not wrong. So it has slowed the spike, and right now we are at 1.5, 1.8. It depends on how you measure that. And that shows that lockdown it's really costly economically and socially, but it does slow the spread of the disease. Now, we're not in a lockdown anymore. Now we're into that whole social distancing, wear face masks. We've shifted our strategy. We'll have to see how it goes. We're around 1.8, which is not that good, but not that bad.
Okay, it is good to know that. I would like to ask you if that estimation is made for specific cities also, or it is just for the whole country?
No. So we know that there are some cities that are doing a better job than others. Even more than that, Colombia has around 1,100 municipalities. Most of them are really, really small. But when you see by municipality, you see that around 60% of them do not have coronavirus, not a single case. And those are open. You don't see anything right there. And among the ones that you do see, you can see that there's a big difference between some that you think are really doing a really good job, like Antioquia and Santander. Some that are where you've had these outbreaks and you see that they're not doing that good, like Cartagena and Leticia. And then you have Bogota, which is the biggest city. We have around 20% of the population of the country living here. I'm not going to say a really good job, but I think it's been somewhere in the middle. We do not have those estimations per city, though. We only have one for the whole country.
Does it mean that the policies are different for different cities according to the contagious spread?
So the one place where you can see that they really, really, really did something really good was Antioquia. And what they did was a little bit taking, the lessons from Korea. What they started doing was they did two things. They did pour a lot of money into the whole test, track, and isolate strategy, which I think is really good. And the other thing that they did was they put a lot of thought into developing apps that could kind of track the people that you were in contact with. So I think that was really, really good. At the same time, you can see some other cities where there's this balance between what the government can do and how people are going to respond to that. So, for example, if you go to Cartagena, where we've had these really bad outbreaks, you go there and you check the security feeds, and you see that even when they were supposedly in lockdown, people were coming out and having parties in the street and all that. So you can design policies however you want, but if you do not have enough enforcing mechanisms, then people are going to behave differently depending on their, cultural differences. I would say that other than Medellin, the strategy has been somewhat consistent in the country, which has been more focused on lockdowns, try to not go out of your house unless you're doing something that's really essential. In terms of what they're doing, the only really comprehensive strategy that I saw in the country was the one that Antioquia did.
Changing the topic, I would like to ask you, what's the economic toll of the pandemic response on the healthcare system?
There are a lot of things that happen in Colombia when it comes to the healthcare system. The first thing is, and you have to understand that we have a single payer, right? So everyone's insured, but we still have two different regimes. One's that's subsidized, and that's for the poor and vulnerable population that wouldn't be able to afford insurance, and one's that called a contributory regime, which is paid by everyone in the country. They take a portion of your salary, and that's it. Then you get your insurance. In terms of income for the system, then we haven't really seen it yet in terms of the contributions. They have not fallen yet, but we do expect that with the increase in unemployment, a lot less people are going to be able to afford belonging to that system. Then we're going to have to subsidize them. We are going to lose a lot of income from that. Now, from the expenditure part, the really interesting part that started happening was that we already know that we are going to have a really big expenditure in the pandemic. How much are we going to expend is going to depend on how many people are going to be infected. We have the projections from epidemiologists that makes us kind of know how much we're going to spend. But the other part that started happening was if you go to a hospital right now, it's going to be mostly empty. And some of that is by design. So when you have the lockdown, part of what we wanted was, since we couldn't instantly increase the number of ICU beds, what we did was, with the lockdown, with people not being able to go out of their homes, those ICU beds started going empty, right? So we could use them more for coronavirus when the spike happened. You don't have people getting into traffic accidents. We chose to postpone all elective surgeries and all that. And the other part that happens is people are afraid of going to a hospital because they feel that they might get the disease. When you see the numbers, you see that the health insurance companies are spending a lot less money on diseases and things that they used to do with the money. With that saving, we are going to finance a lot of the expenditure from the coronavirus. If you